Hello, my name is Trish Waringa, and I am a private practice lactation consultant in the Central Illinois area. My business is Total Lactation Care. And I am here today to discuss with you the signs and symptoms and the resources available to you if you feel like your baby is having difficulty with feeding due to tongue and lip tie. There are several signs and symptoms for the baby that include poor latching, difficulty with air intake during the feeding. We call that aerophagia. Your baby might just be very gassy, or people may think that your baby has reflux. If they are popping on and off of the breast very often, if they're leaking milk out the sides of their mouth with either breastfeeding or bottle feeding, if they are having difficulty making a lot of noise, clicking, popping, choking, gagging, spitting, those are some reasons that you want to be evaluated. Also, a very short or very long feeding. If you feel like your baby's not getting what they need because they are feeding for too short a period of time or too long of a period. There also might be a difficulty with a transfer of milk on a weighted feeding, which may equal poor weight gain. There are also issues with bottles and pacifier difficulties. If you want your baby to take a bottle or if you want your baby to take a pacifier and that's just not happening because of a tongue thrust reflex or something like that, we want to evaluate. If your baby has a white-coated tongue that is not associated with yeast, if it's difficulty cleaning the top of their tongue on the roof of their mouth, that could also be a sign and symptom of tongue and lip tie. You might also have a difficulty with flow, okay? If your baby is not able to coordinate the flow of milk from the breast or bottle, that could also be an issue. The mom might have a lot of pain or trauma, cracks, bruising, bleeding, blisters. They might have a history of mastitis, recurrent plugged ducts, vasospasm, yeast. They might also have milk supply issues because of poor transfer of milk and poor removal. They might also just have this intuition that something is wrong. So there are resources available to you. We want to make sure first and foremost that there is a very good evaluation of feeding. Issues with tongue and lip tie include both functional issues and anatomy. So that could be an evaluation by a lactation consultant, by a speech therapist, your primary care provider. We want to make sure that this is a multidisciplinary evaluation. Once that evaluation and diagnosis is made, they will refer you to a provider that releases tongue and lip ties. That could be a primary care provider. It could be a dentist. It could be done with a scissors. It can be done with a laser. Regardless, we want to make sure that function and anatomy are evaluated prior to a release. Then the release happens. And then very important is the aftercare. This is also a multidisciplinary approach. We want to make sure that habilitation happens. We want to make sure that feeding is safe and the wound is managed. So we have resources here in this area. Please feel free to reach out to any lactation consultant, talk to your primary care provider, and do some research on tongue and lip ties. There are lots of resources available to you. Please contact us if needed. Good luck to you.